Dr. Peter Glidden, your steadfast advocate for health. Thanks for your time. Here's the rundown on high blood pressure from the naturopathic, holistic medical perspective. So, first things first, as far as I'm concerned, in order for you to have a definitive diagnosis of high blood pressure, you have to have 3 consecutive readings where each number is elevated above this baseline, 140/90. So both numbers have to be higher than 140/90, right? So the top number has to be above 140, the bottom number has to be above 90, and it has to be like that 3 times in a row in order for you to be clinically diagnosed with hypertension, high blood pressure, as far as I'm concerned. Now, the American Heart Association has different parameters for blood pressure. Of course, they've lowered the numbers over time. And I'm of the opinion that they lowered the numbers over time in order to sell more high blood pressure medication pills. But nonetheless, as far as I'm concerned, in order for you to need a medical intervention for high blood pressure, which, by the way, is called the silent killer, because you can have blood pressure through the roof and you wouldn't even know it because you can't really feel that. You can only measure it with a blood pressure cuff, right? But in order for you to be medicated or to have some type of aggressive blood pressure therapy, the top number has to be elevated above 140 and the bottom number has to be elevated above 90 3 times in a row. If just one number is elevated, or they bounce, right? The top number's elevated and then the next time it's okay, and then the next time the bottom number's elevated and then the next time it's okay, you are borderline hypertensive. And borderline hypertension is very easy to address with medical nutrition. Quite frankly, high blood pressure is also very easy to address with medical nutrition, because remember, the holistic naturopathic treatment strategy attempts to cure the condition. It attempts to address the fundamental cause of the condition, and your medical doctor doesn't think that that's possible. So, if you are in fact hypertensive or borderline hypertensive, the first thing to think about is your body is deficient in calcium and magnesium. Now, calcium and magnesium are 2 of the 90 essential nutrients, right? There are 90 nutrients that your body needs, essential nutrients. The body needs them, but it cannot make them. Calcium and magnesium are necessary for the constriction and relaxation of muscles in the body. And it may interest you to understand that your veins and your arteries have muscles in them. Many more muscles in arteries than in veins, but nonetheless, there are muscles in your blood vessels, and the muscles constrict and relax in order to help your heart pump blood throughout your body. Pretty ingenious. In order for the muscles in your blood vessels to constrict and relax appropriately, you need to have sufficient levels of calcium and magnesium. If you don't, the muscle will constrict, but it can't relax. Now, if you have a garden hose, right, and you squeeze it just a little bit, you increase the pressure and the water comes out faster. Well, the same thing happens in your blood vessels. When they get constricted, because the muscles in them constrict but they can't relax, the blood pressure goes up. And that's the first thing to consider if you are suffering with borderline high blood pressure or frank clinical high blood pressure. You don't have enough calcium. You don't have enough magnesium. It's that straightforward. You don't have a bad gene. Now, if you undergo a medical nutrition intervention that supplies you with all 90 nutrients plus extra calcium and magnesium, and you still have a blood pressure issue, then, well, that wasn't the problem, or it wasn't all of the problem. The next thing to consider is that you have something called peripheral arterial disease in the kidneys, which basically is clogged blood vessels inside the kidneys. Now, the kidneys are a fascinating mechanism. You have 2 kidneys, a left kidney, a right kidney, and they're located in your back area, kind of between your hip bone and your rib cage, kind of, sort of. The kidney's job is to filter the blood and create urine and remove urine from the body. So the urine that the kidney creates is an accumulation of the waste products that have accumulated in your blood. So your kidneys remove the waste products, make urine, and get it the heck out of Dodge. That's the function of the kidney. And there are some blood vessels in the kidney that are so tiny, so unbelievably tiny. One red blood cell at a time can pass through them. These blood vessels are most easily visualized with an electron microscope. And it's easy for these blood vessels in the kidney, because of consistent consumption of all the wrong food and not enough antioxidants in the body and not enough essential nutrients, it's easy for those blood vessels to get jammed up and clogged up. Now, when that happens, the kidney secretes a chemical called a renin. And renin goes through the body, goes through the bloodstream, finds its way to the liver, and the liver creates another biochemical from the renin called angiotensin. And angiotensin increases blood pressure. It constricts the blood vessels. What's the body trying to do? The body is attempting to blow through the jam in the blood vessels, right? If you have a clogged toilet, you get the plunger out and you try to blow through the clog. Well, the body is trying to do exactly the same thing. Blow through the clogged blood vessel, in this case, the kidney. So, a peripheral arterial disease of the kidney is often a culprit associated with borderline hypertension or frank clinical hypertension, high blood pressure. Both of these things, calcium, magnesium deficiencies, and or peripheral arterial disease of the kidneys, are relatively easy to get on the other side of with science-based, clinically verified medical nutrition. Thanks for your time. Hope you learned something. See you around camp.